Assalamu alaikum. Hello, welcome to another episode of Health is Wealth. I am your host, Shabnum Riaz. Today we're here at Shifa International Hospital and we're going to talk to Dr.Asaad Akbar, who is the Chief of Cardiology here. We have a fantastic program lined up for you. Do watch it and listen to all the benefits that are given by our health expert, and I promise you, you will not be disappointed. So let's go and talk to Dr. Khan. And we're happy to sit down with Dr. Asaad Akbar, who has, very happily given us the time today despite his very, very busy schedule. Thank you very much, Dr. Khan, for sitting down with us today.
You're most welcome, and sincere apologies for making you guys wait. And I hope, inshallah, we'll make up for it.
No, I'm sure we will have a very informative program for all our viewers. Yeah. And as I explained in the introduction, Dr. Asaad is an interventional cardiologist, also the chief of cardiology here at Shifa International Hospital. And we are going to talk about some unique skills that are being performed here by Dr. Asaad and his team, and what they are, so that people who are suffering from heart problems are going to cardiologists, they will get some more information on what actually is current and what is new and things that are developing. So it's going to be very, very important and informative. So Dr. Asaad, if we could start, what advancements would you say that interventional cardiology has seen during the recent years?
Thank you for giving us this opportunity, and I hope we can communicate some of these advancements to our audience in a way that they understand that there are options now for things which were considered untreatable in the past. So some of the things that have really taken off in Pakistan in the recent past, the reason I'm saying Pakistan is because previously the rest of the world, at least the European world in the, or you can generalize it as the West, they were doing these procedures for a few years, but in Pakistan we have only been able to introduce them in the recent past, and for a few reasons, and probably the two primary reasons were lack of resources. Obviously our general population still unfortunately cannot afford a lot of these, and then obviously there was a lack of expertise, which at least now we have overcome. And regarding the resources and the monetary part, we have been subsidizing them, these procedures, to as low as possible. So for one of the things that we do at Shifa International, which is very unique, only a few or handful of other institutions in Pakistan have started doing them, that is called transcatheter aortic valve replacement. In Pakistan it's commonly known as TAVI. In US we would call it TAVR. It's the same procedure where patients who are considered at high risk of dying, if they were to undergo surgery for that particular procedure, now have an option. Previously these patients were just given medicines for as long as the medicines would hold them up for.
So to interrupt you there, which patients would they be who would have been at high risk?
Good. So a lot of comorbidities, or what we call as other diseases that the patient has, makes them high risk for anesthesia as well as surgical complication. If they have untreated or poorly controlled diabetes, they run a high risk of infection from the wound sites. If they have been heavy smokers in the past, they cannot tolerate anesthesia, or if they can tolerate anesthesia, the anesthetist finds it hard to take them off the ventilator after the procedure, which again puts them at high risk of dying because of ventilator associated infections and other complications. And then there are patients, let's say, who have poor kidney functions. If these patients are to undergo surgical procedures, during surgery the blood flow to the kidneys is maintained by a machine, which is obviously you cannot consider it as good as the natural heart. And if the patients undergo a procedure that requires them to be on that machine for an extended length of time, they are at a slightly higher risk of ending up on dialysis. And then fourthly, the patients who have high bleeding risk because of various issues. And then we have females, specifically females, younger females who have had breast surgeries done primarily for cancers, and then ended up with radiation to the chest. So their chest walls bleed a lot more commonly and a lot more severely as compared to general population. So these patients end up with a higher risk of infection and bleed if they were to undergo this particular procedure via surgery. So we can bypass all of these issues by putting, by doing essentially the same thing via small nick in the groin area, and we can pass these tubes, obviously under strict guidance with X-ray machines that we have in the cath lab, and also we are monitoring them with ultrasound machines, both of which are pretty safe in terms of their effect on the kidneys and the lungs. And
sort of like the procedure when you do an angiogram, is it?
Pretty similar, but
yeah.
it requires slightly bigger catheters and a lot more experience and expertise, but very similar. Similar concept that we go through the blood channels in the legs and we end up in the heart. We do not cut away the diseased part of that particular valve. We just push it on the side and deploy a new valve in there. It has been shown across the globe that it has a much lower risk of strokes with it, much lower risk of complications like anesthesia and stuff. In a lot of patients, we do them without even anesthesia. We can just do them with sedation. Patient is happily sedated. They are sort of, they are a bit drowsy, but they are not really intubated and stuff like that. So we can avoid all those complications if we can manage to do these procedures via percutaneous route, or what we call as the way that you have put it, the way angiogram is done.
Okay, so who actually needs this procedure? Who is this for?
So it's people who need this procedure are very clearly defined by a good few medical criteria. And just to put it simply, patients who have tightening or narrowing of the aortic valve. Aortic valve is the main valve in the heart which connects the left ventricle or the pumping chamber of the heart with the rest of the body. If this valve is not opening, the heart is trying to push blood out to the rest of the body, but the body cannot get it because the door is not really opening up. And if this door narrows down to a specific point, patients start getting dizzy, they start falling around. Usually this occurs over 10-20 years. So patients do develop mild symptoms early on, which a lot of them would brush away as symptoms because of aging and things like that, because most of the time it occurs in young patients, older patients.
Okay.
So, and because Pakistan...
Around about 50 plus?
Yeah, 50 plus, unless you have a defect in that valve by birth. And if you have a defective valve, then it can come in 40s as well, 30s or 40s. Right. But majority of the patients that we deal with are in 50s and 60s.
How common is it here in Pakistan?
It's so, unfortunately, like a lot of other medical conditions, we don't have an exact data of this disease in Pakistan because nobody is really looking into it. We are trying to make a consortium amongst a few of the sites who have started doing this procedure, that whoever are the people are coming in for this particular procedure, we are trying to gather their data and combine it across the entirety of Pakistan to get some sort of a number as to how common is it. But in rest of the world or Western world, as your age progresses, the chances can vary depending on which country's data you take, can vary from 1% to 5%, but it varies a lot. We have actually no data of India or Pakistan as to exactly, but the main reason is until the patient becomes symptomatic from it, and until the patient realizes that they are having symptoms, a lot of them have already died because of it, and a lot of them don't get to an appropriate medical practitioner who is able to pick it up. Okay. Yeah, exactly, in time. And by the time they reach us, it's too late at time because the heart muscle has already gone weak, so we cannot help them at that.
So what are the symptoms that you're saying that
so three symptoms are very common, and the first paper or the first properly done paper on them was actually written up in 1986 in US, and those three criteria still hold true. in this day and age. One is shortness of breath on exertion, and so don't rub or brush aside any shortness of breath that you are getting now, which you were not getting 6 months ago. And the second part is heart failure, or you getting fluid in the lungs because of the valve being tight. And the third part, or third symptom, is syncope or dizziness or falling down for no reason. Don't keep thinking that you are falling around because your foot is slipping.
Right.
If your foot was not slipping before and you cannot really remember that your foot slipped, then you need to be checked out for this. It's called aortic stenosis, narrowing of the main valve of the heart. That's
Right,
a disease.
okay. Are there any particular group of people who are high risk for this?
Old people.
Oh,
So
gotcha.
even so, as I said, if you are born with a normal aortic valve, then the only thing that puts you at risk, or one of the things that puts you at risk, is age. That's probably the commonest reason.
Okay.
Then there is some evidence that chronic kidney disease puts you at a high risk of it, but it's mainly age driven. With age, these valves, which are opening and closing with every beat of the heart, just like a normal door hinge, if you keep using it, it's like it's opening and closing 60 to 70 times per minute for thousands of times during a person's lifespan. The hinges start getting diseased, and that's exactly what the problem with this valve is. It's 3 doors at the exit of the heart. Once the hinges start getting diseased, just like you need oiling or something for them, for this particular thing you need to change it.
Okay, right. So do you get patients who come in with recurring like chest pains, and you do all the diagnosis and everything, you're doing all the imaging and tests, but there's nothing really wrong with the heart? Do you get a lot of those coming in for the emergency
yes.
rooms? And what is it then usually?
Chest pain, the thing with the heart, which I tell all the patients, is the way our system works, the brain has a few sensors across the entire body. The sensors are essentially nodes in the fingers, in the heart, and every part organ of the body, which relay a certain stimulus to the brain. So these stimuli, or the signals that these sensors, or essentially it's a reporting system to the brain. Let's say I have put a person on gate number 5 to tell me 10 people are coming in through gate 5. Then there's a person on gate number 3. He's telling me 10 people are coming in through gate number 3. So the way our body works is, if the brain thinks, or the way we have evolved or we have been made, is in areas where the brain needs to know exactly what's happening, the pathways or the door or the roads for these signals to come to the brain are separate, like our fingers. Even if you close your eyes, somebody pricks your finger at 2 different points, even if they're really close, you can easily tell without even looking at it, it's 2 pricks, not just 1.
Right.
But in rest of the body, like some of the body organs, like heart, tummy, your gallbladder, it's not like that. The brain does not feel it needs to put in those exactly localizing sensors in those areas. Okay. So the pathway for these signals to travel to the brain are all conjoined. So if there is a pain in your tummy, it might feel like the heart pain. And if the heart, because the signals are traveling back through the same channel, so the heart pain might be the tummy, might feel like a tummy pain, and tummy pain might feel like the heart pain. To make it more complex, some of the parts of the lungs are passing through the same channels. Right. So if there's pain in your lungs, it will feel like pain in the heart. So it's very varied as to what might be the reason. Most common reason in Pakistan is either a stomach problem or a chest problem. But that's why we need sort of rest of the history of the patient to help us guide which particular organ it is. But because the brain does not have the ability to differentiate whether it's the heart or the tummy, then we have to do it based on few tests, but only the test can only be recommended after listening to history of the patient. So 70% of the diagnosis is made on the history.
Right, okay, because I've seen that, in Pakistan and the rest of the world, and here as well, if you come into the ER with chest pain, they take it very seriously.
Yes.
and they quickly work up everything because they want
so the
to
first thing they will do is an EKG or ECG of the heart,
Right.
and because of all these areas that are perceived by the brain as the heart, heart is the most important one.
Right.
So we always make sure that we do an EKG, make sure there's nothing horrendous going on there. If we see something on the ECG, everything else can wait, and we start sorting out the heart issue. But as I said, a lot of time it might feel like the heart, especially commonly patients would tell you, I feel my heart is sinking, but it's not actually the heart sinking, it's just a stomach bug or stomach problem, because they are being relayed to the brain via the same channels. So brain
Right.
cannot differentiate which part is.
Right.
So it has to come from a physician who would take a careful history, examine you, and then 80% of the time you can just reach the diagnosis based on these two.
Based on your dealing with patients every day, what is the thing that you find more frequently that is avoidable, and you feel that you're repeating yourself to everybody and telling them over and over again, and you would like to sort of get out on a more wider
scale.
platform as like this program? So what would you
This
say?
is probably my most favorite question in all TV channels. In fact, if nobody asks me this, I would request them off camera to ask me this question. The biggest problem in Pakistan is patients stopping their tablets, and I just cannot emphasize it enough. Some of the cardiac conditions like blood pressure, high cholesterol, and then diabetes, which is sort of a cardiac condition as well. These three are the commonest
So
reasons.
that is a cardiac condition as
Yes,
well, diabetes?
So in Pakistan, we are sort of either the world's at a pandemic of diabetes. We
Yes.
have we are either world number 2 in terms of the incidence of diabetes that we have in our population, or in some studies even trying to approach the number 1
Number
slot.
one, yeah.
Which was unfortunate.
Yeah.
So lack of acceptability of the diagnosis, patients don't accept it, because diabetes and blood pressure does not kill you straight away, at least in most of the cases, and it does not give you any symptoms. Patients feel they are okay.
Yeah.
And then unfortunately, I'm repeatedly saying the word unfortunately, and that is because in Pakistan, whatever is the job allocated to a person, they do not consider it their job, and they consider everybody else's job as their job. So most of these patients, one of the commonest areas of interaction of our patients with other population is the mosque, or at these meetings, a random person is just going to tell you, I took this tablet and this happened to me. And then they would just stop taking that tablet without even asking you about it. And they would believe that random person, who might not even have a matriculation degree to their name, as more intelligent than a doctor who has studied for so many years, treated hundreds and thousands of patients like yourself, and is telling you repeatedly that you need to take this tablet. One thing that everybody needs to understand, if you have diabetes, if you have high blood pressure, or if you have been diagnosed with heart disease, or if you have high cholesterol problems, these 4 are going to stay with you for the rest of your life. None of these are fixable permanently by a course of 1 month or 2 months. As long as you take tablets for them and keep a check on them, you can live a totally normal life and manage. But if you don't take these tablets for them that have been prescribed to you by a qualified doctor, the only person you are doing injustice to is your own self. And so WHO is probably the only one of the primary organizations which is gathering data from grassroots levels in Pakistan. In 1999, the data that came out of them, where this showed us what was the commonest cause of death in Pakistan, and it was coronary artery disease or heart disease. And we have all been studying this through our medical schools and stuff. In 2019, the latest data that they came out with, they said the commonest cause of death in Pakistan now is high blood pressure. It's heart attacks have moved to number 2. Cancers are even down the line. And we are scared of cancer way more than heart attack, and blood pressure is nobody even cares about it. I know a lot of even my family members who would very proudly tell you, my blood pressure runs at 180. nothing happens
I
to me.
have-
I can work very
I
normally
agree with
Yeah.
you here that
They
this
consider it
sort
as-
of
yeah.
they sort of brag about
Brag
it.
about it. Yeah,
that
I run
have-
180.
oh,
I'm
good.
totally fine about
Yeah,
it.
170, 160. What are you worried about?
And the only thing, yeah, and so they need to know that that is the commonest cause of death right now in Pakistan. If your blood pressure runs just 132 by 81, so that the regular average blood pressure recommended by American College of Cardiology, European Society of Hypertension, and European Society of Cardiology, average blood pressure is 130 by 80.
130 by
By
80.
80. 130 is
I
a-
had read somewhere that they had pushed it up to 140 by 90.
Well, that is for
not-
patients above 65 years of age,
Above
or if
65.
you have a kidney disease.
Okay.
In these
Otherwise,
two conditions,
it's
otherwise it's
130
130 by 80.
So,
But 130 by 80 is the upper limit. The blood pressure should be 120 by 80-ish, right? 130 by 80, we can deal with it or we can tolerate it. But 140 is for patients above the age of 65 or if you have kidney disease. Everybody else, it's the same. But if your blood pressure runs at an average of even 132 by 81, the risk of stroke goes up by 10%. So just imagine you multiply these numbers to 180 and then just count what the risk of stroke is if you're running at blood pressure of 180. So that is one. Secondly, patients who end up on dialysis. In Pakistan, there are three common causes of patients ending up on dialysis. One is kidney stones, number two is diabetes, and number three is blood pressure.
kidney stones as
Kidney
well.
stones is a very common cause in Pakistan.
I don't think many people know about that. That is
Yeah.
so important.
Because they feel that as long as we are not getting
In
any
pain,
pain,
and
we
it's
are
just
okay.
there
It's
and
just there. Yeah.
so ignore
So
it.
if it continues to grow in size, it can obviously obstruct the kidneys and they will stop
Right,
working
right.
slowly. If it's an acute kidney pain where the stone gets stuck in one of the tubes of the kidneys, they will get pain. But a slowly growing stone which is just obstructing the outlet of the kidneys is not normally going to give you pain. And by the time you realize it, one of the kidneys is already gone. So kidney stones, diabetes, blood pressure, these three are the commonest reasons for patients ending up on dialysis. So two of them come in our domain, and I keep telling the patients about with diabetes and high blood pressure, even since 2003 at least, that I remember, as far as because that's when I was in med school, that it was a recommendation even then that anybody who has diabetes, regardless of what their cholesterol level is, they should be on a cholesterol pill, even if it's normal, because that's how lethal diabetes is for the heart, for causing stroke and everything. But for some reason in Pakistan, people are so fond of taking uric acid tablets. They're very fond of taking an aspirin. Both of them are not really backed by much of data. The commonest prescribed pill in the world is a statin, which is a cholesterol medicine, way more in number than aspirin, that we thought was the most commonest prescribed drug until you actually look into it. So if there is a reason for these pills being prescribed so commonly. So in Pakistan, a cholesterol medicine should be the highest prescribed pill because every diabetic should be on it once you're over 40 years of age.
Right.
And every heart patient should be on it. If you have high blood pressure, then the criteria for normality of your cholesterol level is more strict. So a lot of our patients fulfill that as well. In this particular belt, which is called the South Asian belt, unfortunately we are born with genes where the body is not able to get rid of this cholesterol on its own, and we need some help. If you do accept this diagnosis early on in your age, we are talking about teens. So in these patients, the disease caused by high cholesterol level starts getting roots into the arteries in teens, late teens. And if you have a family member who had a heart attack or a stroke in their 40s, or now we have patients even in their 30s, but at least in their 40s, then if you have a kid who is in early teens, you should get their cholesterol levels checked. And now the recommendations are that these kids, even in their teens, should be put on these cholesterol lowering tablets, because by the time they reach 40, the disease has already developed. There is no medicine or pill or any of these Hakimi medicines or any dam durud that can reverse the disease once it has come. The time to fix it is in the teens. If your family members have a tendency of developing heart disease or stroke in their 40s, or they're dying suddenly of chest pain or in their sleep, then you need to get them checked out in their teens. That is the time when you can actually save them. By 40s, everything has already happened. So you need to fix it in their teens.
So basically what you're talking about is for us to be more proactive.
Yeah.
Why? I mean, honestly, I just do not understand.
And accepting of the fact
exactly.
that there is a disease which is in me and I need to treat it without treating
Instead
it.
of being in denial and realizing
Exactly.
that it's going to catch up
Denial.
with you anyway.
Exactly.
And with a much worse condition.
Exactly.
Whereas, again, you as a medical expert would say to the patient that, you know, this was happening for so long.
Yeah.
I gave you these medicines. You didn't take the medicines. This progressed to this.
Yeah.
So why is that mental block? Why are we doing that as a nation?
While we're talking about it, one thing that now that you put this question up, probably the fourth thing which is a really sore point for me as well, and that is smoking. So smoking causes all of these as well. When we are talking about heart disease and strokes and stuff, I tell the patient that there is no antidote for smoking that has been created by the medical world. Once you have been smoking for a while, the risk of cancers, over 100 cancers increases multifold, right from the mouth all the way down to your bladder. And all of these organs are affected by smoking. So that is something that is probably as lethal and toxic as diabetes and high blood pressure. So there is a denial about it. There is no doubt about it. People do not want to change their practices, like desi ghee. Everybody considers it to be really healthy. It's healthy because it probably does not have those chemicals that are being added to some of these vegetable oils that we are using, but it's not really healthy for the heart or for the brain. With one last thing, then we can move on to the next question. One thing that people need to understand, the word they use, we are doing parhez. So parhez is, everybody has their own definition. I eat a paratha in the morning and then I don't eat it. They think because they're not eating ghee for the rest of the day, they are parhezing for the rest of the day, and they're only non-parhezing for that part. I met somebody who told me that they are treating their blood pressure with parhez. So the parhez they were doing was, they would eat a proper breakfast, then they would parhez till afternoon, then in afternoon they'll eat a proper meal, and then they'll parhez till the dinner. So I was telling them, well, that is exactly what not parhezing is. So parhez, and so that is about them. But people who are well educated, even they think that parhez can fix everything. From heart side of things, from diabetes side of things, from cholesterol side of things, parhez can only get you up to 20% lowering of these levels. 80% of it will come via tablets. If your cholesterol is above a certain level that your physician can tell you, you have to be on a tablet.
That is a very, very
because
important point.
Exactly, because and the reason is that more than 75% of the cholesterol that our body has to face is made by the body itself. Cholesterol is a very vital element of the structures that are being built by the body every night. Like, I'm sure you would have read about it or heard of it. One thing is kids grow at night, the other thing is muscles grow at night. And the reason is all the muscles that we use during the daytime, they break as they're being used, and then the repair work happens at night. So cholesterol forms the major cementing structure for this buildup of muscles. If so, the body produces a certain amount of cholesterol, so that at night, when the rest of the body is fixing whatever got damaged during the day, then the cement should be there for the body to reconstruct the building back up. The cholesterol that is used up is all good. The cholesterol that is not used up is normally thrown out of the body by your liver. So there are certain doors in the liver that pushes, through which the body pushes this extra cholesterol into your stool, and you poop them out. If these doors are defective and they're not really opening up to as much as required, the body will have no area but where to throw this extra cholesterol out of.
Right.
So 75% of this cholesterol is essential for us, so the body makes it ourselves. the body only relies on the oral cholesterol that we take in for 25% of its needs, because that is the maximum you can produce, essentially take in, even if you are on a non-parhezi diet.
So if people think that they can lower their cholesterol by eating boiled food or stuff,
yeah, it's only by 20%. So that's why let the doctor decide.
80% will be done by the medication.
By the body itself. So if your cholesterol, let's say the LDL cholesterol level that we recommend for a normal person is about 100, and you come into me and you have an LDL cholesterol of 160, I know straight away that no matter what you do, you cannot lower it by parhez only. You have to take a certain amount of dose, a certain dose of the tablet to help you get to your levels. And once it gets to that level, nobody should stop this tablet, because this tablet is only in the body for a few days. The reason for explaining this whole thing in detail is because you need to understand that your body is making it every day. So a tablet's course of 1 month or 2 months, a lot of, unfortunately, our general practitioners stop these tablets as well, because once they see a normal cholesterol level, they'll tell the patient, you don't need the tablet anymore. But you do, because 75% of it was coming from your body, and it is still coming from your body. The moment you stop it, it will take the body usually 1 to 2 weeks at max, and you're back to where you started from. Again, which will put you at risk of strokes and heart conditions.
The whole cycle starts
once
again.
you and so there is this myth in the population that once you have been started on a cholesterol pill, you will have to stay on it for your life. And I tell them, it's not because you have been started on it, it's because you needed it. If your cholesterol level was not at a level where you needed it, we won't have given it to you. Because it's at a level where you needed it, that means your body needs the tablet. If you don't take it, you remain in denial, you're just going to harm your body.
Right, okay. So you mentioned statins. There are quite a few people who say that when they take statins, they have incredible muscle pain. And that is the main reason for them sort of like shying away from them or not taking them. So what is the remedy for that?
So the way I would put it is, that's very commonly asked, but there are few things that patients forget when they are blaming the statins. Number one, lack of exercise is the commonest cause of pains in our body. Just like with every other organ, if you're not exercising, you will have body aches and pains. And if you think about it, very few, you will not remember a lot of people who are very active complaining about these muscle aches and pains. So that's one.
Right.
Number two, in general, the Asian population does get muscle aches and pains. So these muscle aches and pains are directly the incidence is directly proportional to the dose of these tablets. So in our population, we don't go up to anything more than half the recommended dose. So we are already giving you half the dose. And then thirdly, we have other ways of reducing it, like do not stop these tablets on your own. Get medical help. There is evidence that even if you can manage to take these tablets like twice a week, they will still help you. But the chances of muscle aches and pains go down. So there are loads of ways to work around it, but definitely not taking it. And then lastly, people who can afford it, we have an injectable form of it, which is now available in Pakistan. It will cost a good few bucks, but that's given in an injection form every 6 months under the skin. That has been valid. It's FDA approved. It's being given in US to patients who are deemed intolerant of statins. So we have options for you, but for that, because there is a cost issue with it, so it's not for everyone.
How much is it for?
So it has just been DRAP approved. They have got their first shipment in Pakistan just last month, and the way they are telling me, I think for a whole year's course, it will be around $1 million, something like that.
Okay, right. So there's always that option for somebody who could afford it.
Who can afford it.
Who could afford it, then you have that option.
But I won't recommend using that option even if you have money, unless you cannot tolerate statins, because the body of evidence for the benefit the body gets from statins is way more, because they've been in the market for 30 years, 40 years. So we know there are multiple mechanisms by which they prevent strokes and things like that. This medicine tells us, this medicine has the evidence that it can reduce your cholesterol levels to the same levels. But because it's only new in it's only come out in the last 3-4 years. We don't know it's 20 years efficiency data or 30 years efficiency data, but it will lower the cholesterol. So in theory, it should produce the same sort of benefits that statins did.
Right. One word you're saying a lot, you know, when you're talking about other issues and diseases is stroke. Now, in the West or abroad, many people are educated to look out for the signs of stroke, to understand how quickly they need to get to emergency or take certain precautions. How many times have you had a patient come in where they've had a stroke that either could have been preventable, or if it had been acted upon quicker or faster, they would have saved themselves from maybe paralysis or whatever?
Yeah, no, that is again a very pertinent question. I think, just last week, we had a patient who had a sort of what we call as a mini stroke in general population, where they lost sensation in a limb for a few minutes, for a few seconds, or for a few hours, and the whole thing recovered. They did not bother going to a practitioner. What we know, obviously I tell all my patients that the final decision lies with Allah Ta'ala, and we have nobody has any qualms about it. But as far as the knowledge of medicine is concerned, we know for a fact that once you get a warning sign like this, in the subsequent 30 days after that, there is a chance of a bigger stroke, which is at a much higher likelihood than general population. So if something like this happens, you need to be checked out by a properly trained physician who will run few tests. There are
sorry to interrupt you,
yes,
what would be the symptoms? The symptoms for the mini stroke?
So lack of inability to speak or comprehend what the other person is telling you about or talking to you about.
Okay.
As a family member, you might see that the other person is not responding the same way as they would, or you might see them dozing off. You might see a slurring of their speech, you might see a bit of drooling, which recovered by itself. Any of these, and especially when you have things like blood pressure or sugar in your system, have to be taken very seriously.
Okay.
If you have been given a second chance by nature to get help, then get it and do exactly what the doctor tells you. Do not make up explanations for it, because once you have had one episode, within the subsequent 30 days, you have a very high risk of a proper stroke coming up.
Okay.
Where you can lose a limb, you might lose the ability to speak, you might not be able to see things clearly, and you will end up with that disability for the rest of your life.
So this is basically your body sending you a warning.
A warning. And not everybody is lucky
that they get that.
They get it. A lot of time the first thing you get is a stroke. But if you have medical conditions like blood pressure and diabetes, you have a much higher likelihood of getting a stroke. So as long as you are treating your blood pressure and diabetes properly, not in your own head, but something that your doctor is telling you that these are okay.
And the results will show
that. The results would show that, yes.
They're okay.
We get patients who come to you after 10 years and they have never got their sugar checked, they have never got their blood pressure checked, and because they are not getting any symptoms, they would assume things are okay. So you need to at least visit a doctor once every 6 months to get these blood tests done, especially if you have any of these medical conditions.
Right, and that's why they are dubbed silent killers.
Exactly, both of them. And as I said, according to WHO, high blood pressure or poorly controlled blood pressure is the commonest killer in Pakistan right now. So if you have high blood pressure, it's nothing to be proud of or boast about that I run a blood pressure of 180, I feel as energetic. They would tell you that I can lift more, have heavier stuff than somebody my age with a normal blood pressure. And I keep telling these patients that do not consider yourself a miracle of God. Like, you are a normal human being like everybody else. And if the other person is at a risk of dying because of it, you are at a risk of dying because of it. So please consider yourself as mortals, as normal human beings. If your entire family tree is full of patients who have died early from heart disease, there is a very high likelihood that you have the precursors for it. If you recognize it in time, you can outlive your parents, but if you do not recognize the time and remain in denial, you will end up with the same fate. Likelihood is, in fact, for coronary artery disease or heart disease, the way the genetic tree works, there is a phenomenon called anticipation. So if your parents died in 60s, there is a higher likelihood of you dying in your 50s and not reaching even 60s, because in every subsequent generation it actually comes even sooner. So if you have family members like this, make sure your kids who are in their teens are checked out in their teens, and especially cholesterol levels, sugar levels. Just even these two blood tests, if you get them, they will save you a lot of hassle in the long run. Just these two blood tests, cholesterol levels and their sugar levels.
But I've noticed one thing in Pakistan, that people will be more likely or inclined to invest in a plot than invest in their own health.
Yeah.
I hardly ever hear anyone talking about precautionary measures regarding their health.
Talking about precautionary measures, and then the first part of the question was investing in a plot. We say it slightly differently, but comes to the same end result. I would say they will go to McDonald's, they will spend 2,000 or 3,000 on a meal, but if you tell them to get your cholesterol level checked, which costs about 1,000 rupees in a very good lab, you can get it cheaper, but then I won't trust those results. But in a good lab, 1,000 to 1,500, and that you only have to get it checked like once a year or just once in your lifetime. That will get you an idea where you sort of stand in the natural scheme of things. They would be reluctant. They will tell you it's very expensive. But if you walk out, they will be eating out at a restaurant or hotel, and they won't even think twice when you're talking about paying to that restaurant. And then again, investing in a plot, the plot prices have to materialize over years. So you should be able to live past those years to see it actually maturing. For that, maybe invest in yourself before you invest in a plot, because you need to outlive that plot.
Exactly. And as you mentioned the junk food, so the irony there is that rather than going for a test, you'd rather go take yourself and your family to a fast food outlet where all the food is actually really, really harmful for your health.
Exactly. That is true. And when a few of these families, when they came to me with very aggressive history in their family of heart disease, everybody having a stroke or heart attack at a very early age, and I told them that how old, and I asked them how old your kid was, and he was in late teens, and I said he should be checked out as well. And they would all be like, Dr. Saab, khuda ka khauf kare, why would I ask this guy, or iska cholesterol zyada hai, so what will you do? And I'll tell them that I'll put him on a statin, but he's too young. Well, if he's not young for junk food, he's not young for preventive stuff as well. So if you're putting in junk food in his mouth, which is going to harm him, then probably you should consider putting a cholesterol tablet as well that might prevent heart attack.
It's all about the mindset. Unfortunately, we have run out of time, and you know the interesting thing is that all the questions I had prepared for you,
none of them were
I didn't get to get,
we can have a second session
because everything was so important and so informative. Thank you so much, Dr. Asaad Akbar Khan, for being with us today here on this program. Everything that you have said, if our viewers, really, really sit down and implement those things, they will see such a difference in their health.
Inshallah.
Absolutely wonderful content. Before we end the program, a quick message for our viewers.
So, as I said during the talk as well, I think if you have to do one thing, I think get out of denial. If your family history has people in it with heart attacks and stroke occurring early in their ages, you should get yourself checked out. And if a doctor recommends a blood pressure medicine, a sugar medicine, or a cholesterol medicine, please be informed that these medicines are for life. They are not like a flu jab or a flu tablet that will end in after a week's course. So please be accepting of this fact, because just accepting this fact can save you a lot of trouble later down the years. Thank you.
Thank you very much. And that brings us to the end of today's program. Until next week, stay happy, stay healthy. Bye-bye.